At least his teammate covered him up.
Here they come right back at you. Sumner on the drive. And a foul on Cannady, and he grabs his right leg.
So we've seen this before. How many times are we going to have an open ankle? It's like, okay, here we go again, an open ankle fracture, a gruesome ankle fracture. All fun and games aside, pretty brutal for someone who has an open fracture. You know, interesting. I don't know if you noticed this, Joey. All of the media suddenly switched to saying open ankle instead of compound. I wonder if it had anything to do with that video from way back when. Ha, funny that. So anyway, so he has an open ankle fracture, right? What does that mean? We've talked about it. The important thing is, most important is deal with the soft tissues. So you deal with the open portion, stabilize the ankle temporarily, get him into the operating room, prep him, antibiotics, clean him up. Most important part of treating an open ankle fracture is what? Was that dramatic enough?
It was good. And you didn't do a sound effect.
I did not do a sound effect. You can. So, which means what? Open ankle fracture, the most important is the cleanup, the washout, the surgical debridement. Yep. Basically, the ankle's open, so first things first, obviously the first line treatment is you cover the wound, line up the ankle, put a splint on it, and take him straight to the ER, prepped, get ready, into the OR. Then what do? You take all the dressings down, you wash it out. My routine is you wash it out with, pour some saline, iodine all over it, and then make sure the gross contamination is gone after all the soft tissues. And obviously you're not going to do this with the sneaker or the sock on, right? Okay, so that's all gone. I'm sure there's someone that's nitpicking out there that says, hey, what about the sock? You didn't say you'd remove the sock. It's like, yeah, we do remove the sock, buddy.
You leave the sock on? What kind of a surgeon are you, idiot?
There's always one of those, right? So you clean it up, okay, and then you're going to examine. And there are times, I've had this, plenty of patients like this, the bone's sticking out. So before you pop it back in, and this will happen in the ER, it may not happen on the field. Sometimes you have no choice. You don't want to have them sitting with the bone sticking out on the field. Sometimes you just cover it up, put a splint on, and take them. But, if you're out in the backwoods or the backcountry or skiing or something, you don't have a choice. You just pour some water on it and then line it up, put some sticks or splint, and get them to a facility. But in this particular case, this is the NBA. They have people that are smart enough. And so it's going to be washed out. And then you line up the bones. Sometimes you put plates and screws immediately. Sometimes you have to do serial debridements, not Captain Crunch cereal. This is serial debridements. That means sequential, one after the other. So if it's really dirty, say you find a piece of sock inside the ankle, or say you find dirt or a piece of leather torn and ripped inside the ankle. Well, then you're going to wash it out, and then you're going to line it up, splint it. Maybe you put an external fixator, which is pins holding it out, and then you bring them back in 1 to 2 days. You wash it out again, and then you see. And then the option becomes, do you close the wound? Do you leave it open? Do you treat the wound with serial checks? And then do you plate right away, or do you plate and fix at a later point? All of that depends on the type of injury. Now, this definitely was more than likely, based on the mechanism of injury, even though we didn't see the actual camera on the ankle at the time of the injury, it was an inside-out open. So that means that for the most part, it's cleaner than if it was struck and you had a dirty contaminant break through the skin and break it. In this case, it popped open from inside out, meaning the bone fractured, or it dislocated and it pushed through the skin, ripping the skin from inside out. In which case, it's contained within the sock and shoe, and so you can consider it not clean, but cleaner than a dirtier wound, which is out in, say, motocross. Plenty of those injuries, you smash it, you get hit by a rock, or you fall and you stumble, and there you go. And then it's from outside in, and then you have dirt and grime. I have found gravel in joints. I've found carpet in joints. I've found dog hair in joints and open wounds. It can be pretty gruesome, but you deal with it, you clean it out. It's nothing that any orthopedic surgeon can't do, but it's pretty straightforward. It's just principles and practice of orthopedic surgery, which every one of you know now because I've been teaching you all this, right? But don't stay at a Holiday Inn, because you're not going to be as good as me just staying at a Holiday Inn, right? Yeah, you need to be certified. You need to go through the exams. In any case, that's about all the detail we have on the ankle, that it was an open ankle fracture. We don't know if it was just the medial malleolus. Was it the lateral malleolus? Was it a fracture, dislocation? Were there any other ligaments? Were there any other bones involved? Was it bimalleolar, trimalleolar, which means 1, 2, and 3 malleoli? So we don't know any of that. But in the end, ultimately, wound care first. Bone stabilization and ankle joint stabilization comes second and third. So clean out the wound, stabilize the joint, and fix the bones, and then you go on to healing. He's a young guy, he's healthy. He'll be, I'm sure he'll heal fine, bones heal well. The biggest risk is infection with open ankles, so that's the thing we'd most worry about. And then secondarily is the healing. In healing, there's so many factors. For the most part, for a young, healthy, active athlete, his bones and tissues should heal fine for the most part. If he's a nicotine smoker, you know my rule on nicotine. Nicotine sucks the oxygen out of tissues. It doesn't suck it out, but it constricts the vessels. If it constricts the vessels, you're not getting oxygen. So what happens there? You don't get healing. 17 times worse bone healing with a nicotine smoker. Doesn't matter if you chew or whether you smoke. Don't smoke. I feel like a Sunday school special right now.
Join me in a cigarette.
What do you think, I'm crazy?
Don't smoke. So I would say that basically we're looking at, 6 weeks to 8 weeks, healing, walking, 3 months, 6 months, rehab. He's out for the season. He'll be back.